All right, peace be to you all. Assalamu alaikum. Omar Abdul-Malik here. I wanted to talk to you guys briefly about the difference between hospitalist medicine versus medicine practiced at a private practice. So I do both. I'm a physician associate with a doctorate in health education, but I use both of those backgrounds to do both private practice as well as hospitalist medicine. So it's private practice with internal medicine. I should clarify that. So internal medicine is just adults. Most of my patients in the practice where I work range from middle-aged people, mostly folks in their 50s, all the way up to some folks in their 90s. So I see a lot of age-related disease, and then disease from just some poor lifestyle habits. So type 2 diabetes, so hemoglobin A1Cs. That's a particular marker for being able to see how well a person's diabetes is managed. Sometimes those are in the double digits. They should not be. If it's somebody with type 2 diabetes, it should be below 7. I'll do another video on that in the future, inshallah. But things like poorly controlled hypertension, poorly controlled cholesterol levels, COPD from years of smoking, and sometimes even living in the inner city here, where I work and live, but also things like asthma, and then joint-related issues, osteoporosis, osteoarthritis, rheumatoid arthritis, that kind of thing. In the hospital, a lot of my patients are already diagnosed. So if I'm doing something like an admission, they already have a set of diagnoses. So I don't have to come up with a differential diagnosis unless there's some type of exacerbation that the patient has. They have different acuity levels in the hospital. So maybe a patient's just coming in to complete a course of antibiotics for something like osteomyelitis, that's a bone infection, and they don't have any other morbidity. Or I may have a patient who's got multiple morbidities. They've got respiratory failure, they've had a heart attack, they've had multiple strokes, they've got amputations, they've got things like chronic kidney disease from poorly controlled type 2 diabetes. So they've got diabetic nephropathy, and they might even have to get evaluated for possible amputation. So in the hospitalist setting, or the hospitalist capacity, I've got to be able to think fairly quickly on my feet. If a patient's becoming septic, do I do something like pan culture them? And that's where you get cultures of blood cultures, stool, sputum, let's see, what else, urine. What kind of entries do they have for possible sources of infection? They have a Foley catheter, maybe a possible UTI, or something called a tracheostomy, where they have a tube in their trachea and they're hooked up to mechanical ventilation. Do they get ventilator-associated pneumonia? Why is their temperature suddenly spiking from 98.6 to now it's 101? I've got why are their white blood cells spiking? Do they have something called leukocytosis? And then I've got to know how and when to refer to the specialist. So maybe an infectious disease consult or a cardiology consult. So sometimes time can be of the essence, especially depending on the acuity of the patient. And then family members are involved also. They want to know what's going on, provided if they are the point of contact. So it requires a different type of thought process. Unlike in the private practice, it's a bit slower. The patients may come in and you're following up on things. So maybe they had labs done, several weeks ago, and they just want to go over their labs. Maybe they've got some kind of complaint about stomach pain or something like that. And is it GERD or is it gastritis? Do I order an H. pylori breath test or an EGD? Or refer them to the gastroenterologist, or sometimes send them to the emergency room. because there's nothing I can do for them in this little office. But that also requires a good understanding of pathophysiology. That's something I had in the didactic phase of my training. But both types of patients are fun to work with. I think in the hospitalist setting, it's more of a team effort where I'm communicating with my supervising physician, the nurses. Got some great nurses with whom I work. Respiratory therapists if the person's on mechanical ventilation in particular, physical therapist, occupational therapist, and the case manager, because we can't keep the patients in the hospital forever. But if we're doing a discharge, we've got to make sure that it's a safe discharge and they have a safe place to go. Are they going to a skilled nursing facility or are they going home? That kind of thing. In the private practice, it's just me, the medical assistant, and the supervising physician, if he even happens to be in the office for that day. So I've got a bit of independence with both roles, but it's enjoyable. I've been a PA for almost 25 years now. It's a great profession. If you're interested in being a PA, it takes an undergraduate degree. I'd suggest usually doing something in biology, life sciences, because that way you'll cover all of the prerequisites. And then you take your graduate record exam. You also have to get a background in health sciences before you apply to PA school, because you need a lot of direct patient contact hours depending on the school to which you're applying. So it's good to be a certified nursing assistant or a phlebotomist or a medical assistant or an EMT, that kind of thing, before you apply to PA school. And then hopefully you get granted an interview and get in and do your 1 year of didactic, then 1 year of rotations in various specialties, OBGYN, emergency medicine, surgery. And then you take your boards, your physician assistant national certification exam, and get that job and make your money and start upon your career. It's a lot of fun. Now, it differs from being a medical doctor, because medical doctors do 4 years undergraduate, 4 years of med school, and they got to take steps 1, 2, and 3 of the USMLEs. I'll talk about that in another video, inshallah. Then they got to get matched. Then they do their residency. If they're doing it in internal medicine, like a capacity in which I work, that's a 3-year residency. And then if you start talking about doing specialties, there's a year or 2 of fellowships, depending on what they are specializing in. So it's the depth and breadth of training between a PA and a medical doctor is markedly different. But us PAs are here we're here to help. And I've enjoyed helping. So that's it for now. If you want to be a physician associate or a health educator like me, I will leave my email in the description, and you can contact me and follow me, and I'll give you some advice that's hopefully helpful, inshallah. All right, guys, I wish you guys the best of success in your positive endeavors. Take care. Peace.